Good afternoon, Premier and Dr. Hinshaw. This is a question for the Premier, but if Dr. Hinshaw wants to weigh in as well, the more the merrier. Every day that I've tuned in to these updates, there's been asked at least once, and sometimes oftentimes, why not impose a lockdown? So for the Premier, let's say right now you had a complete change of heart and you said, you know what? I'm going to close all the restaurants, all the bars, all the gyms right now, right today, this very moment. Would that really achieve the goal? Doing that, especially with the transmission rates you're talking about, would that achieve the goal you're trying to achieve? In other words, the reason you don't want to lock down again, is it a philosophical reason, or is it because it would not achieve the goal of bringing the cases down, or is it both?
No, it would not achieve our goal, because our goal is not to take COVID-19 to zero. Our goal is to keep the spread under control so it does not overwhelm the healthcare system without hammering our broader social, economic, mental and physical health. So the goal is, if the goal was just single-mindedly to take the virus to zero, as some other jurisdictions have tried to do, then it's a pretty easy policy decision in a way. You just, impose maximum restrictions, lock everyone in their homes, stay-at-home orders, shut down every business, close the schools, and watch massive social and economic damage ripple through society. We have demonstrated through most of the past 9 months that we can live responsibly with COVID with limited, targeted, smart, data-based measures that do not cause massive, widespread damage to the health of our society. We need to get back to that, which is where we were through most of March through October. That's our goal. We do not think it's realistic that the cost to people's lives and livelihoods of trying to go to zero until there's a vaccine, and we don't know when that would simply be unacceptable in our view. That's not a question of ideology. We're following data. We're following evidence. And people who are hounding us to shut down restaurants, why? Because they want to, quote, do something, when our data indicates that 0.7% of identifiable transmission has occurred in restaurants and similar businesses. So what we're doing today is we're focusing on an area of much more significant transmission in a much less structured environment, which is at-home social gatherings. And social gatherings more generally. So our approach will continue to be informed by the data and by balancing the COVID concern with other broader social, economic, and health concerns. Having said that, I've been clear, Rick, from the get-go, that as much as I believe Albertans want to maintain what I call responsible freedom in all of this, if folks don't respond to the kind of voluntary measures we're calling on today in Calgary and Edmonton, no more at-home parties, for example, if they don't respond, we will have no choice but to bring in more stringent measures. I don't want to do that. And finally, let me just say, I'm sure people who call for, quotes, lockdowns are well-intentioned. But I would ask them to be compassionate for the people who are barely hanging on to the, for example, restaurateurs whose life savings are tied up in those businesses that are barely surviving today. I'll just focus on that industry. 15,000 restaurants in Alberta employing over 200,000 people, many of them people with modest incomes. And to say, you know, in sort of an excess of caution, even though it's not supported by the data, we're going to shut them all down as we go into the Christmas season. Usually, they're the only season in which their best season of the year, without that being supported by the data. What happens to those folks? When they lose their life savings, when they lose their jobs, when they lose their incomes, what happens to their mental and emotional health? So I would just say to those folks, we will continue to stick to our goal, and we just ask Albertans to help us do that so we can get back to where we were earlier in the year.